Hello, everybody. So I'll start off with some of the slides, and I think going through those, we'll talk a lot about what my job involves, in the neuroendocrine tumor clinic. So first, we're going to start off talking about oral chemotherapy. Perfect. So what is oral chemotherapy? Half of you in the room might be very, very familiar with oral chemotherapy, and maybe some of you have never been on oral chemotherapy or knew that that was an option. So oral chemotherapy refers to a chemotherapy or cancer treatment that is in the form of a pill, tablet, or liquid form, essentially something that's taken by mouth. Compared to, what most people think of with cancer treatment, chemotherapy, they think of infusions, where you're sitting in an infusion chair and it's something that's being delivered through the vein. So this is the same treatment, but it's delivered in a different route. You can see on the slides, there's many different oral chemotherapies available for neuroendocrine tumors currently. So that's kind of why I wanted to talk about this today. There's, a lot of things to keep in mind if you're on an oral chemotherapy. Some of you might have heard of these, capecitabine, and of course every drug has at least two names just to keep you confused. But capecitabine, temozolomide, everolimus, a few others I have listed, that maybe you've heard of or been on yourself. So you might be asking, why have I never heard of an oral chemotherapy, or why am I on an oral chemotherapy? So it depends. Oral chemotherapies aren't an option for everyone. It depends on your specific type of tumor and your grade, your stage, etc. So it's not a clear-cut option for everyone. So I'd like to compare differences between the types of treatment. So intravenous, or something given through the vein, kind of similar idea to any other injections. So the somatostatin analogs like octreotide, lanreotide, similar idea to intravenous therapies. So those treatments are given in the infusion center at University of Miami. We call that our CTU. So that's something that you're physically going in to a clinic to receive, versus oral chemotherapies are something that typically you're going to be taking at home. The scheduling is a little bit different. So typically for intravenous or another kind of injection, depends on the drug, but it might be something that you get once a week, every 2 weeks, every 3 weeks, every 4 weeks. Oral chemotherapy, of course, it can vary by the drug, but some of those, it's a pill that you're taking every single day. Sometimes you're taking it for a week or two in a row, and then you have some off weeks. So the scheduling is different. But what's important to know is both of these options are effective at treating your cancer. It just depends on your exact situation. And both of these, unfortunately have side effects. Neither of them are perfect. And whether you're receiving oral chemotherapy or chemotherapy in the infusion center, you're still required to, get lab checks, be seen by your oncologist, make sure that, you're doing well on the treatment. Even if you're on oral chemotherapy, it doesn't mean that you're sent home and you don't see, your doctor again. So some examples, intravenous chemotherapies you might have heard of: carboplatin, cisplatin, etoposide, immunotherapy like nivolumab. So those are some of the examples of intravenous chemotherapies. So pros and cons of oral chemotherapy. So like I said, it's not perfect. One of the major pros and advantages of oral chemotherapy is the flexibility and convenience. For most people, it helps you to have more of a normal routine. If you want to work, it allows you to continue working for the most part. If you want to take a vacation, travel, it is certainly more convenient. So I included a picture of the beach. If you wanted to take a vacation to the beach, the oral chemotherapy, makes it a little bit easier for that. When I was actually in pharmacy school, I volunteered at Dana-Farber, and oral chemotherapy has actually been around since 1950s is when it was first approved. But when I was at Dana-Farber, I remember there were posters all over the place. Oral chemotherapy, it was really starting to grow and develop, and it was this huge advantage. There's something that you could take that doesn't require you to be in the infusion center. This is also a huge advantage for rural medicine. Say you live 5 hours from the nearest neuroendocrine specialist or cancer center. This is a huge advantage where you're not having to travel back and forth as much. Even in Miami, you might live 10 miles from Sylvester, but you might feel like it takes you an hour or two to get in. So that's really the biggest advantage that oral chemotherapy has. On the other side, which I'll talk more about, oral chemotherapy requires you to have what we call good adherence. We want to make sure that you're taking the pills correctly, the way we want you to, and we need you to tell us if you're having any issues or side effects. Another difference, so oral chemotherapy, you don't necessarily need vein access, so maybe that's not an option for you. Oral chemotherapy is an option, but with oral chemotherapy, you have to have good gastric absorption. So depending on your tumor or surgeries, sometimes that's not an option for everyone. With oral chemotherapy, it's not guaranteed. You might actually have to come in more frequently, but sometimes it allows more flexibility where you might be able to do less labs and less visits to the cancer center. Another difference is side effects. So with oral chemotherapy, it depends on the schedule. But if it's a drug that you're taking every single day, the side effects are more expected, more consistent. You might feel a little bit tired every day versus with some of the other intravenous chemotherapies, say you get it every 3 weeks. You might feel really tired for 1 week and then have 2 better weeks. So that's another advantage, a little bit more predictable, consistent side effects. Also, what some of the presentations were about earlier is oral chemotherapies can sometimes target specific mutations. So that's really where oral chemotherapies are growing, being able to target some of those mutations. Of course, some of the intravenous options can too. So another con with oral chemotherapy, though, which we'll talk about more, typically it takes a while to start. These are delivered to your house, they go through specialty pharmacies, insurance has to be involved, so there can be some delayed. Sometimes they can be expensive, and another thing to keep in mind is these are technically hazardous medications. So if you have children, pets at home, you have to make sure that you're keeping them out of reach. And there are also more drug interactions, which is definitely an area that I focus on. So with great power comes great responsibility. Thinking of oral chemotherapy, there certainly is more that you're responsible for. I liked this image because, technically on the scale you're balancing the same amount, but oral chemotherapy can pose some challenges. We have to really be sure that you are taking the oral chemotherapy correctly, that it's delivered to your house on time. There's more for you as a patient and caregiver to keep in mind with oral chemotherapy. So the biggest struggle that we have is adherence. So that refers to us making sure that you're taking the oral chemotherapy as we intend, as we prescribe. According to the World Health Organization, medication adherence is defined as the degree to which the person's behavior corresponds with the agreed recommendations from a healthcare provider. And actually, being adherent to medications has been shown to have a bigger impact on your outcomes compared to what the actual treatment is you're on. So it's really important that you're taking these medicines correctly. And it's not a factor of, intelligence or anything like that. The truth is these treatments are confusing, and there's a lot that goes into making sure you're getting the medicine and you're taking it correctly. In other words, if we tell you to take 2 pills every day, are you taking 2 pills every day at the correct time in the correct way? And I really like this chart because it shows that there are many factors that go into play with medication adherence. When I was making these slides, I was first, highlighting what I thought was important, and then I realized everything is really important. So some patient-related factors, barriers to care, the cost of oral chemotherapies, and some other treatment-related factors. If you don't have any symptoms from your disease, do you feel like you have to take the pill every day, or can you just take the pill when you're not feeling well? You have to take it every day. So that actually comes up quite a bit. Side effects. These treatments still have side effects. If you're having side effects, you have to tell us. Provider-related factors are also really important. If you don't have a good relationship with your doctor, if you don't think that the treatment's going to work, that's going to come into play. Maybe you're not going to take the pills at home. Something I wanted to highlight is the complexity of treatments. So anyone that's been on Cape-Tem, which is the combination of capecitabine and temozolomide, might appreciate this example. So Dr. Chauhan, he wants to start you on Cape-Tem. So I'm going to go through, how you're going to take this. We're going to set up treatment for you. So first I tell you, okay, you're going to take this one drug twice a day on days 1 through 14. You say, okay, that seems okay, I can do that. And then I say, but wait, there's another drug, temozolomide. So you need to take that on days 10 through 14. And then you're like, I have to figure out when day 10 is. What is that, 4 days? Is that 5 days? So it gets confusing there, and you're thinking, why can't I take it days 1 through 5? Why can't I take it every day? And then you have 14 days off. So normally when I tell people about this regimen, they look at me like I'm crazy, and they're wondering why I make it so complicated. It's not my fault. So here you're wondering how you're going to keep up with this regimen. And then I go in to actually order it. So the computer tells us, okay, based on your height, your weight, your temozolomide dose should be 355 milligrams. So the computer, a robot, automatically thinks this is what we should send you. So we're going to use 3. So temozolomide, comes in many different strengths. Other drugs sometimes come in just one pill form, only 20 milligrams. Temozolomide comes in many. Part of that is because it's used frequently for children and all kinds of indications. So the computer says, okay, I want you to take 3 of the 100 milligram pills, 2 of the 20 milligram pills, and 3 of the 5 milligram pills, all at the same time on days 10 through 14. And you're still wondering, when is day 10 through 14? So this is where we come in, and I say, well, I have common sense. The computer might not, but instead we can send you 2 of the 180 milligram pills, and we can round your dose to 360 milligrams, which is the same exact thing. So this is really a responsibility on your provider's part to make sure that your treatments are as straightforward and simple as possible. It's not always an option, but this is just to highlight, where things go wrong. It's not intelligence, it's not, even if you have a medical background, this is confusing. This took me a while to get the hang of. So, say you're prescribed Cape-Tem or some other regimen by your doctor, and you're left extremely confused. You need to speak up and take the time to clarify it and wonder, is there a more simple way I can take this regimen? One thing I like to do, especially for Cape-Tem, is to make a calendar. I like to make this for patients when I go through it, because when I mention day 10 through 14, they're lost. And so I say, don't worry, we'll make you a calendar. It'll say exactly when you need to add in that second pill, and how many pills to take, which days, and when. So there are a few different things that can help improve adherence. One is discussing side effects and concerns with your doctor's office. We don't want to send you this prescription. It's a very important, this is your cancer treatment. It's not something that, we want you to have no idea how to take. So if you're having side effects, if you're having concerns, talk to us. And also involve your caregivers. Anytime you're prescribed an oral chemotherapy, you should have your caregivers, yourself, your neighbor, 5 other people, have everyone read the bottle, have them all tell you what they think the bottle says, how you should take this pill, and make sure you all come to the same conclusion. There's a lot of things going on in your head. It's very easy to mix things up because honestly, it's complicated, it's confusing. There are other strategies, such as having a diary, a log, writing when you take the pills, if you feel nauseous after them, if you notice any side effects on certain days. There's pill box organizers. On this slide, I have 2 examples of automated reminders or dispensers. You can buy these online. They can keep track of what time you opened the box, what time you took the pill, when it's due next, because you might feel really tired and maybe you took your pill an hour ago and honestly you can't remember. And that happens all the time to the best of us. So there are a lot of techniques, strategies to help keep it more straightforward. So another question that patients frequently asked is, how is oral chemotherapy dosed? Say you are a 85-year-old, 90-pound patient. Am I getting the same chemo as, someone who is 20 and in amazing shape, 200 pounds? The answer is no. And it depends on the chemotherapy. So some pills are flat doses. So say everyone, for the most part, is on 60 milligrams. Doesn't matter your size. Some are dosed based off your height and weight. So we calculate specific to you. But regardless of these drugs, your doctor is going to adjust the drug depending on how they think you're going to tolerate it. So not everyone is the same. That's really my main takeaway. Everyone's different. Even if you have a twin who is on the same oral chemotherapy as you, they might tolerate it completely different. So that's what I always tell people. Even if, say we give you 400 milligrams and that's too much, that's not a problem for you. That's our problem that we gave you too much. So part of our job is anticipating how you're going to tolerate treatment. If you're not tolerating it well, you need to tell us, and we will adjust it for you. This is one of the main things. If you're getting intravenous treatment in the infusion center, you have a nurse who is giving you exactly what you need. You don't have to think about it. You have to show up and be there. When you're doing it at home, you really have to take responsibility that you're going to take it on time, that, if you have any side effects, you need to reach out. Another thing that comes up frequently is navigating specialty pharmacies. So, these pills aren't like other pills where you can pick them up at your local Publix. For the most part, these are all shipped to your house through specialty pharmacies. So on here, I have a few examples. Maybe you've used some of these pharmacies, maybe not. At we have our own specialty pharmacy. We also have a Walgreens across the hall from our clinic. Depending on your insurance, they're going to dictate where you can fill with the specialty pharmacy. Something to keep in mind, if you ever change insurance, tell us right away. Don't tell us the day when your pills ran out, oh, I changed insurance and the pharmacy's saying they can't deliver me the pills tomorrow. You need to tell us. So these drugs, are expensive. They need your insurance to approve them, what's called a prior authorization. So any changes in insurance, any issues, if the specialty pharmacy says, I can't deliver them to you tomorrow, call us right away and we can fix it. These are more complicated. For the most part, they're all shipped to your house, so someone normally has to be home to accept it or at least have a good place to put it until you get home to get the delivery. Also navigating high costs. So unfortunately, most of these pills are very expensive, but your insurance should be covering them. We know how that goes. Sometimes you still have a high copay. Sometimes insurance doesn't want to pay for it, even though it's completely appropriate for you. So there are many different options. Giovanna helps play a big role in figuring out how to get you the oral chemotherapy if there's an issue with cost. So some of these you might have heard of. There's a few different options, whether you have a high copay, then we can do like Mark Cuban Cost Plus Pharmacy has some generic medicines at a lower cost. Sometimes there's other coupons like with GoodRx, Onco360. There's also patient assistant programs. Those help you to get the drug for free from that drug company. So those are available with everolimus, cabozantinib. It depends. Based on your cancer center, your team is going to help set you up for those differently. At Sylvester, Giovanna and social work help to get you signed up for those. But what I want you to take away is if the pharmacy says $10,000 is due this month for your pills, you don't need to pay that. You need to tell us right away, and we'll help you to bring that cost down. These are complicated, and we're here to help make you more simple. There's also copay cards, copay assistance, other foundations, but always ask us if there's ever an issue. So in conclusion, for neuroendocrine tumors, there's multiple oral chemotherapies that are used. Whether you're going to be on an oral chemotherapy or not depends on your specific situation. Oral chemotherapy requires good medication adherence. We need you to take responsibility to take the pills on time and speak with us about any issues. But of course, your treatment team is there to help you. We don't want you to feel like you were sent home with this bottle of pills and you have no idea what to do, or if you have a side effect, you have no one to talk to about it. We're here to help. And everyone's different. So Whether you know someone that loves oral chemotherapy but hates the IV, everyone's different. That's really my biggest takeaway. So thanks for listening to me. Hopefully that was helpful.